Hello, I'm Hunter Schultz, and this is Winning Healthcare Food Fights Without the Mess. Today on the show, Gregg Lafferty joins me. He's the owner of Total Performance Auto and Truck in Fort Pierce, Florida. He's also a patient of Dr. Jessica McCain at Southern Comfort Health. He shares a story or two, but there's one in particular that I think really hits home, one you've never heard before. It's about Gregg and a kidney stone, starting right now. Gregg Lafferty, welcome to the show.
How you doing this morning?
Doing terrific. So you're the owner of Total Performance Auto and Truck in Fort Pierce?
Yes, sir.
Are you doing custom jobs, or is it mechanical work? A little bit of everything?
Yeah, I do fleet work for a major company. I won't mention its name. And we do mostly fleet work. Some people off the street. And we have a body shop. We build some custom cars, but not too much, just basic stuff.
Mm-hmm. What's the most unusual thing you've ever worked on?
Oh, Lord. That take me a while to think. Worked on some strange stuff over the years. I mean, it's funny. I have people bring me lawnmowers, weed eaters. They think if you can fix a car, you can fix anything. And generally I will for them, but it's, man, the strangest thing, it take me a while to think about that. I mean, I've been doing this for a long time, and
maybe another question is, what's the most memorable thing you've ever worked on? What are you most proud of?
I'm the type of guy that wants everybody to get the same result, regardless of what it is, whether it's a 65 GTO like we're working on right now, or somebody's Yugo, so, I just want to be done right the first time at a fair price. And, that's about it for me, I really don't know one in particular job though, that really sticks out. I mean, I've done stuff for so many people and organizations, it's not even funny. I get a lot of people that can't afford to fix their cars, and my wife calls me a sucker, but I fall for the sad story. I help a lot of people. I'm never going to be rich, but I can go ahead and I can sleep at night when I go home. You know what I mean? I know I've helped people, and that's all really matters to me.
So the reality show is coming soon.
Yeah,
Gregg's Garage.
Let me tell you what, we tease about that because we have some interesting people that come and hang out, because they're retired and stuff like that. And I shake my head all the time and go, man, we could make a TV show out of some of the stuff that, and the characters of the people that come here every day. I mean, it's like a fixture. And if they don't show up, then you worry, what happened to them, we have a gentleman out right now who comes, he's retired from a telephone company. He comes every day, but he has had to go through a major surgery, so we haven't seen him. And you can tell the difference when he's not around, because we bust each other's chops bad. I kind of miss that, waiting for him to come back.
I worked at a car dealership. Yeah, I know the feeling. There's some good stories.
And then the pranks, there's always the pranks.
Oh yeah, yeah. I'll tell you a few off camera, but let me explore a little bit about your care, because you are a member of Southern Comfort Health. And
yes.
What was your care like before you found Southern Comfort?
Oof. Well, that's a long story. Well, it seems like every time we would enroll for the Obamacare, me and my wife, every summer it would get canceled for whatever reason. And I would lose my insurance throughout the summer until the enrollment came back up again. And I would have to go to an emergency care place to try and get my blood pressure medicine, and making an appointment doesn't do any good, because you make an appointment for 2:00, you'd be sitting there till 4:00, and in the middle of the day, I'm not just one of those bosses that sits around and watches everybody else work. I work, and I do run service calls myself, and I go out there to actually work and diagnose and order parts for us. And it was just terrible. I'll be honest with you. I got to the point where I didn't have my blood pressure medicine for months, and I started feeling really bad. And it all stems back though. When I had my regular, it had the insurance, and I had a doctor in Port St. Lucie. He actually quit. He was with a big organization in Port St. Lucie, and I guess we can't mention names of companies or doctors, I'm assuming, but he was a great doctor. Him personally, I love, but he actually quit this team of group of doctors, or physicians group, I guess, and went on a concierge type deal. That was the first time I've ever actually heard of it. And that was several years ago. But he wanted like $1,800, and I was like, man, my insurance was already costing me $1,000 or $1,300 a month for me and my wife, and then another $1,800 a year on top. I was like, I can't afford it. And so that's when I started using the emergency care when I did have insurance. And then when I lost my insurance, I still went, and then it just got even more expensive. And then it got to the point where I couldn't get help. I would sit there for hours, and I don't know, it was just like cattle running through, and I didn't have nothing for months. And then I talked to somebody, and that's what they had mentioned about Jessica. And I told my wife, I'm going to try it. I mean, I don't feel well. I need to go see somebody. And that's basically how it all started for me.
You found direct primary care through a friend.
Yes. They told me she was new and opening it up, and that she was good and I should try her. When I was at the point, because I felt so bad, that I needed to see somebody, that was going to do something. So I checked it out online and looked at the price, and it was a monthly payment deal, not a big one lump sum. And I was like, what is it going to hurt? Best decision I ever made in my life.
So the difference between the old and the new for you is substantial. And let's kind of touch on something here, that because you're a business owner, and there are a lot of business owners out there, what's the impact on your, I'll say, job performance, your ability to do your work and manage your company, lead your people, develop your business with direct primary care versus the old system?
Oh, just the speed of it. I mean, when you have a 9 o'clock appointment, you walk in at 9 o'clock, there's no sitting in the waiting room and around 20 other people and waiting your turn. I'm there at 9 o'clock. If I get there a little early, I'm right in. They do what they got to do, and then I'm out and I'm back to work. I mean, the time savings alone, that's what I was talking about when I was going to the emergency clinic. You make an appointment for 2 o'clock. Here it is 4 o'clock. You haven't been seen yet. Your shop's going to close in an hour. You're not there to get things finalized and bills. It's just a big, the time savings is incredible. I mean, because there's no lag. You're not sitting around twiddling your thumbs. They get right to you. And you're the only one there. It's very personalized.
Does it make a difference for you that she's available to you? Aside from normal business hours, you have access beyond what you used to have. It's fast access, but you have more access. How does that impact how you feel about your care now?
To me, it means a lot, but I don't like taking advantage of people. I mean, just because maybe on a Sunday I don't feel good, I'm not going to necessarily bother her because I can wait till Monday. Just, I don't like taking advantage of situations, but it's great knowing that if I have to, that I can. I got a story I could tell you that, wait till maybe you get to that, about a certain instance I went through with her that was unbelievable. You would never get this situation, this care would never happen at any other place.
What happened?
Okay. I went to bed at 8:30 one night, and I laid down because I had pains in my sides, and it hurt so bad, and it just progressively got worse and worse, and never stopped. And I waited for her to open up. I mean, I was up all night long with my back with my kidneys just hurting. I couldn't urinate. I mean, it was like every 5 minutes I would dribble, you know. It turned out it was kidney stones. I'm sure you figured that out by now, but it was terrible. So I waited till I went and picked up one of my guys that works for me, and I made him drive. And at that time, I called, and because it was about 9 o'clock by then, and I called their office and answered, and I told them what was going on, and they says, give me a few minutes. They said I could work some stuff out. 5 minutes later, I got a phone call. Come in right now. We were able to shuffle some appointments around. Went there. She went right there. She took me right in. Sent my guy on to work. She pretty much knew what was wrong with me from the get-go, and they gave me an IV and some pain medicine, put me on the couch. They quickly got me an appointment that morning for a CT scan. And believe it or not, and this is what I tell everybody, the doctor took me to the radiologist in her personal car. She took me there, waited in the parking lot while I had my CT scan, took me back to her office, gave me another IV, and by then she had gotten the kidney stone to pass. You know, it had passed into my bladder. By the time I had gotten to the CT place, the medication she gave me and stuff, I was able to pass the big one into my bladder, so that pain had went away. And then after I got back and she gave me another IV and this and that, she was going to take me to work. And I told her, no, you've went way past what I ever would have expected. And I had somebody come and get me. It was just great. I mean, if I went to the hospital, I couldn't have got service or help that quick, you know, and I'm sure I probably could have called her up that night, but, you know, I didn't know what was going on at that point, and I wasn't going to do that, you know, but the fact that she got me in first thing, you know, and the other patients were understood, and they had no problem being moved a little bit back in the day. And you tell me any other doctor's office that's going to do that. I mean, we're not even talking about taking get a CT scan, because that's crazy. And I would never even expect her to do that again. But to just move all your appointments and put you first, that ain't happening at a regular physician's office. It's not. Never happened for me anyhow.
It doesn't surprise me. It really doesn't. I mean, the business model enables her to adjust her time to care for patients that are, you know, the priorities are there. You hear a lot of going the extra mile, going to the house. What do you need? Okay, come on in, or I'll come to you. No, that doesn't surprise me. It's heartwarming to hear, and I think a lot of other people will go, wait a minute, that ain't going to happen with my doctor. He's, you know, he or she are just too busy, or what?
Yeah, it makes you think about those old-timey TV shows, you know, where the doctor actually went to the house.
Marcus Welby, MD.
Yeah, I mean, it's just, like I said, I never expected this to happen, and I would never expect it to happen again. You talk about going above and beyond, and I couldn't thank them enough. I couldn't believe, I mean, not even the receptionist or her office manager, the doctor did it. I mean, that's crazy.
So when you do go in for visits, in the old system, what did you think was consuming the doctor's time the most as you were sitting?
Doctor? Never seen one. I always got a nurse practitioner. When I went to the emergency clinic, well, because that's where I was going for my primary care, I never seen an actual, I mean, I know nurse practitioners are closed, but it's still not the doctor. Never seen one for anything I ever went there for. Never talked to the regular doctor. Don't know who the regular doctor was. It was a nurse practitioner, and it seemed like I would go a couple of times, it'd be the same person, same nurse practitioner. Then next time you go, somebody different. And you're starting over all again with your relationship and going through the same stories over and over and over again. You sound like a skipping record. And it's so frustrating that you have to tell the same thing over and over and over, because it's always somebody different. The personnel in the office were always different. It just seemed like it was like I don't know, it wasn't an ideal situation.
In the medical community, what you just described as a lack of of continuity of care. And for those who are watching, ask your doctor how important that is, if you have a doctor. And just the fact that you have someone who is aware of your situation, knows you, knows how you think, knows your sense of humor, knows what you do for a living, etc., etc.,
Well, that's why I was
etc.
surprised she put me on here, because I'm not the most politically correct person in the world.
But you know what?
I'm honest, I'm me, you know what I mean? I'm not going to put up false fronts, and you get to know them so well. It's like you're talking to your brother or your sister or a friend that you've had for years. I mean, it's just, you just get such a comfortable atmosphere. You don't mind, talking about, your problems. It's not only your health care, it's your mental health, it's your weight. I mean, they'll talk to you about anything. I mean, when they get done doing their checkup and this and that, and they're going to bring you in the office and she's going to holler at me to quit smoking. I mean, that's, I need to lose more weight, but they want to know about, hey, how are you mentally? How's your personal life? You got any problems? They actually give a shit, if I can say that. I mean, they actually care. I mean, you're like a number at these other places, in and out.
How does that make you feel overall, though?
As far as how I'm treated, like part of
tranquility.
I like going to the doctor. I don't dread it. I'm going to sit there for 3 hours and get some half-assed non-answer. I went in for tests at the emergency clinic and I didn't hear back. So I call and I go, hey, I never got the results from my test. Well, if there was a problem, we would have called you. Okay. For the money I paid, I would at least expect something. An email, a letter, a phone
Smoke
call.
signal.
Now, Jessica, she'll tear you up with a phone call, an email, several emails, texts. You ain't got to ask for your results or your information. I mean, I got an appointment, I think, this coming Monday, and I've probably received, I don't know how many texts this week already. They're not going to let you forget. And she sends you an email and discusses everything about your appointment, what you did, what's going on in it. And then you get regular, like she said one the other day about the COVID-19, things you can do and what's going on, and basically giving you more information about it, which I trust more than I do the regular news. I mean, because, you know how it's been going on with COVID, some people it's fake, some people it's real. I mean, I know it's real, but you just don't know what to believe, but I read what she has to say and, and I believe her because I feel comfortable with her, I trust her.
Did your care change very much during COVID?
No, I mean, other than taking the precautions of cleaning your hands and wearing a mask, I mean, when I go in their office, no, I mean, everybody wore their masks and didn't touch me. No, it isn't like they were on the other side of the wall talking to me. They everybody took their precautions and they cleaned up before and after I was there. As soon as I was leaving, the ginger was already cleaning everything up for the next person, and you don't have that big crowd of people in there like you do a regular doctor's office where they're putting you in the hallway or down in the, well, go sit in your car, we'll call you. Really? I mean, I understand you got to take precautions, but why are you scheduling 30 people at 9 o'clock if they are going to sit around the parking lot and stuff, And that's another thing, you don't have to get there. You ain't got to worry about the sitting on the parking lot because there's not 20 people there. You're the person there. It's your time. I guess they allot a certain amount of time for you. I think by the time I'm done, I may or may not see the next person coming in, So to me, it really, the way it works, it really doesn't affect you that much, other than taking the precautions that you need to take.
I sense that there's a lot, and I'm putting words in your mouth, but I've interviewed enough doctors and I've interviewed enough patients to know. I sense there's a lack of fear. There's a lot less fear, uncertainty, and doubt, the FUD factor, now versus before.
Yeah, I don't. How about as far as the COVID or going to the
No,
doctor
just
in
in
general?
general with your care
Oh,
now.
oh yeah, no. I mean, if I go there and she says, I think we should do this, or I think we need to try and do this, I just say, to her, you're the doctor. You tell me. I trust her 110%. You know, I have no reason not to. I mean, I feel extremely comfortable. I mean, I don't. I mean, like I said, I just until a person actually goes to this type of doctor and is in this type of situation, it's hard. They can. It's hard for me to explain. It's just so much more relaxed. The personal is. It's just so personal, and the way they treat you, it makes you so comfortable that I have no problem saying, okay, you're in charge of my health. What do you want me to do? Of course, we butt heads. I need a cigarette smoke and stuff like that. But I promised her, we're going to get there. But no, like I said, she tells me, well, I'm not going to jump off a bridge, but they'll say that she tells me to do it, or this is what we need to try. I'm going to do it. I have no problem trusting her a bit,
Because you have the
and I trust
relationship.
her.
It's the
Yeah,
relationship that you have that has developed over time, and it takes time.
it
So
actually didn't take that long to trust her. And I mean, first couple of times I went, yeah, but every time I went, it didn't take years or nothing. I mean, after a couple months, I mean, it happens that quick. I mean, because you can tell, it's like when people come into my shop. I mean, you can talk to a person. There's any business, you go in there and you start talking to a salesman or any person. Don't take long to read a person, see what kind of person they are and what you're going to get or what you're going to expect out of the business. You can tell whether if they're bullshitting you or they're in a, you just, you know, how their attitude and how they talk, whether you're just a number and they're just looking for your money and in the door and out the door and they don't give a shit. You can read a person and you can tell by the whole situation there that she generally cares about her patients. I mean, it's really hard to explain. You got to experience it for I tell everybody, you got to go. I said, you won't be disappointed. I mean, and I can't explain it. I can't. But
do your friends believe you when you tell them? I mean, I'm sure they believe you, but there has to be a certain amount of what when you tell them the
that's what I
story.
got when I tell them the story about the kidney stone. My parents, their parents, they're 80. My dad's 84. My mom's 70 something. That's pretty bad. I don't remember. But
You don't know yet.
yeah.
Forever
Sorry,
young.
mom. Hopefully she don't get on the computer. She won't see this. Well, my dad might tell her because he does. But nobody can believe when I tell them that story. They think I'm lying. I'm like, no, she took me to get the CAT scan. I mean, and it is unbelievable. I mean, have you ever heard that before?
I haven't heard. I've heard other things, but not that. It doesn't surprise me because they're living their purpose. I mean, a lot of doctors in the old system would love to be able to do that. It's the system they're in, though, and it's important to note that it's the
Well, that's
system.
why my former doctor I was telling you about, who I loved, who actually I built a personal relationship with him too, but because he was in that healthcare system, he was confined by their rules for what he could and couldn't do. And he was telling me, I knew months before he quit that he was quitting and going to open up his own private, thing like Jessica.
What was it, thinking back now, what was it that finally convinced you about direct primary care? Was there any one thing?
I could afford it. To be honest with you, I could afford it. I mean, I could afford the $109 a month. I mean, you think about it. Where else can you go for $109 a month and get seen 20 times if you need to? You know what I mean? And it ain't, oh, it's another $20 copay, it's another $30 copay. You need this, you need that. But it's And it's not only that. I mean, she helps you get. And, like I mentioned earlier about going to a specialist, and she helps you get special prices and cash prices and rates. I mean, she tries. It's not only where she helps you with her financially. My prescriptions, I go through her and I get them, and I get all my prescriptions for a fraction. I mean, just as cheaper, and I was getting them with my insurance. I don't even know how to say it. The money I was paying a month for regular insurance, I never even come close to that in a month. Now, I guess it would mess you up if you get something major happens to you, and I'm looking to get some major medical care insurance. It's not so easy to get though. They don't want to give you just major medical. That's the biggest downside to it, I guess you would say. But heck, I would have to go to the hospital for kidney stones, and I didn't. She took care of it, so you know, I
That's
I have no problem with her handling any other issue I get. I'll go to her first before I ever go to the hospital.
well, that's unless it is an emergency, they are the focal point for care, meaning the primary care doctor in the right system.
She wants to know that. She says, if you're going to the hospital for something, you call me, let me know you're going and why you're going. She still wants to know.
Yeah.
And so most people say, okay, go ahead and go. But no, she wants to know. She don't. You call me. You've got my phone number. Text me, call me, let me know you're going and why you're going. So,
Fair to say that she's also a guide for navigating through the system,
yes,
hand-holding.
definitely. Most definitely. Oh, yeah. Oh, yeah.
Gotta
I
love
mean,
that.
Yeah. I mean, she's offered, hey, there's ways, I can help, there's programs where I can help you quit smoking. We can get you this, that for free. It's not going to cost you nothing. I mean, their big goal is to save you money, and she does. I mean, everything that she's done. I mean, they try to help. They literally try to help you physically, but financially too. I mean, it's anybody that doesn't. It's hard. I think, like I keep saying, it's hard to explain, but man, I wouldn't trade it for the world.
I was. You just answered a question, which is, would you willingly go back to the old system?
No.
I think we know why.
No, I hope that nothing happens to Jessica, and that's where I am when the day I die. No, no.
If you had the nation's attention for 1 minute, what would you tell them about DPC? What would you say?
Don't knock it unless you try it, and I guarantee you're going to be 110% satisfied. Assuming, I guess, all doctors are the same as mine, but I think anybody that's doing this, they are the same because they generally care. I mean, if you want somebody that cares about you and actually not worried about just taking your dollar, you need to go to DPC. I tell everybody, and I tell them that one story because that's my biggest story with her so far. I mean, and nobody believes it.
It's a big
nobody
one,
else is going to do that for you.
Gregg Lafferty, it's been a real pleasure.
Well, I hope you found something in this you could use. And it's been
Indeed.
a pleasure talking to you.
Oh, thank you. And yes, indeed, that story is epic. I'm going to definitely use that. And
all right.
For Winning Healthcare Food Fights, I'm Hunter Schultz. Stay healthy, wash your hands a lot, and there you are.